afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Nigeria's revenues and foreign exchange earnings fall by nearly 60% due to the coronavirus pandemic. More state chapters of the Nigeria Association of Resident Doctors (NARD) join nationwide strike as doctors' action threatens the health sector. And Libya reports more than 1,000 new coronavirus infections, the highest tally for a single day since its first cases in late March. Good evening, everyone. Nigeria has exceeded the 55,000 mark of confirmed cases of COVID-19 after 100 cases of the virus was reported by the Nigeria Center for Disease Control, NCDC, Sunday night. And it was from 9 states and the Federal Capital Territory. Lagos recorded the highest, 39, and several other states, the FCT, Kaduna, Oyo, Ebonyi, also recorded a number of cases. It was the country's lowest daily figure in almost 5 months. And when you look at the Channels Television COVID-19 case monitoring dashboard, you can see the representations in Nigeria, the confirmed cases, and then this is our active cases as at today, 10,935. Of course, over 43 persons have recovered from the virus in the country, and sadly we've lost 1,057 people to COVID-19. Lagos is still leading, and when you talk about the total number of confirmed cases, with its figures at 18,347, slowly, steadily approaching the 20,000 mark. There are several other states as well. The FCT is third highest in terms of confirmed cases, but when you take another look at it, and that's the cases that we're managing, all the cases in admission as at today, you'd see that the highest now of the states is the FCT, and then you have Lagos, but they're all managing a little over 1,000 cases on admission. Now, this is a virus that's affected the 36 states of the Federation, and talking about including the Federal Capital Territory. And these are certainly the figures that are coming in. Of course, the Nigeria Center for Disease Control has said that perhaps a decline of about 40% from the 745, talking about Nigeria's infection, which was the highest as at June. But according to the PTF, collection of samples declined in at least 6 states across the country in August, and the number of deaths from the virus has also been low. But experts, they've ascribed low testing across the country to perhaps some of the reasons why we're seeing a decrease, downward slope with regards to the coronavirus. But in the meantime, and that's away from the figures coming in from the NCDC, now President Muhammadu Buhari at the 57th ordinary session of the ECOWAS Authority of Heads of State and Government presented a special report on COVID-19 pandemic in the one-day summit. Appointed ECOWAS champion on the fight against COVID-19, he observed that the summit was holding under a very complex health pandemic whose impact on the global health and economy has so far been devastating. Now, President Buhari has charged his colleagues on the need to continue to work in concert with each other on several fronts to ease the negative effects of the pandemic, adding that we need to demonstrate our collective resolve to harness the opportunities that come with COVID-19 despite its overwhelming negative impact on lives and livelihoods. The president, however, expressed confidence that in pooling resources together, the region can save the present generation and generations to come from multiple challenges, including COVID-19 and related health issues. Like every other part of the world, Africa has been affected by the pandemic with over 1.2 million infections and more than 31,000 deaths occasioned by COVID-19 recorded on the continent. Cases in the West African region are presently at 164,365 with 2,465 deaths recorded. Now, Nigeria's revenues and foreign exchange earnings have fallen by almost 60% since the coronavirus pandemic took hold. This is according to remarks from President Buhari delivered by Vice President Professor Yemi Osinbajo at the start of the first-year ministerial performance review retreat holding in Abuja. He said for the government, it has been a particularly trying time that as a result of the poor fortunes of the oil sector, revenues, foreign exchange earnings have fallen drastically. It is a first-year ministerial review retreat taking place in Abuja meant to review the performance of the ministers since their inauguration 1 year ago.
The COVID-19 pandemic has led to a severe downturn in the funds available to finance our budget and has severely hampered our capacity. One of the steps we took at the beginning of the crisis in March, when oil prices collapsed at the height of the global lockdown, was the deregulation of the price of premium motor spirit such that the benefit of lower prices at the time was passed on to consumers. This was welcomed by all and sundry. The effect of the deregulation is that pump prices of petrol will change with changes in global oil prices. This means, quite regrettably, that as oil prices go higher, we could see some increases in pump price. This is what has happened now. When global prices rose, it meant that the price of petrol locally would also go up. There are several negative consequences if government should even attempt to go back to the business of fixing or subsidizing petroleum prices, or PMS prices. First of all, it will mean a return to the costly subsidy regime. Today, as we've heard, we have 60% less revenues. We simply cannot afford the cost. The second danger is the potential return of fuel queues, which has thankfully become a thing of the past. There is no provision for fuel subsidy in the revised 2020 budget, simply because we are not able to afford such a cost. If reasonable provisions must be made for health, education, and other social services, we simply cannot sustain petroleum subsidies. Nevertheless, I want to assure our compatriots that Nigeria is extremely mindful of that the government is extremely mindful of the pains that higher prices may mean at this time, and we do not take the sacrifices that all Nigerians have had to make for granted. We will continue to seek ways and means of cushioning the pains, especially for the most vulnerable in our midst. We will also remain alert to our responsibility to ensure that marketers do not exploit citizens by raising pump price arbitrarily.
Resident doctors nationwide have embarked on a total indefinite strike today. The doctors say the action is the resumption of a strike which was suspended in June to give the federal government a chance to meet their demands. They claim the federal government has been slow in meeting some demands and not forthcoming in others, which include implementation of the Residency Training Act, payment of COVID-19 allowances and inducements, and others. In the nation's capital, Abuja, doctors under the Federal Capital Territory Administration chapter had started their strike on the 1st of September following the non-implementation of the variation of the 2018 promotion exercise. The Taraba State chapter of the National Association of Resident Doctors joined the nationwide strike today. According to the association, consultants, which constitute 20% of the workforce, will be only the ones on ground to render skeletal services pending when their demands are met. While giving reasons for their action, the association insists the strike is the only language the federal government listens and understands. Now, over 100 resident doctors in Bauchi State downed tools, except those working at the COVID-19 isolation and treatment centers. Patients could be seen at the hospital, but services were slowed down. The president of the association says resident doctors form over 90% of doctors in the hospital. Over in Katsina State, over 300 resident doctors constituting 95% of the total workforce joined their counterparts across the country. The president of the state chapter of the association told Channels Television that the strike is necessary after the federal government failed to fulfill the chronic demands of the association. And resident doctors at the Federal Medical Center, Diaba Abeokuta, also joined their counterparts nationwide in the industrial action. In Lagos State, physicians decried the federal government's slow inaction on the demands as well. Now, Dr. Abiodun Paul is a public health expert. He joins us from our Abuja studios. We'd like to thank you for joining us on the program.
Thank you so much, Millicent, for having me. Thank you.
All right, first I want to get your reaction to what one might call a strike too many. The Association of Resident Doctors National, they've begun the indefinite strike. Do you see an end to the myriads of strikes in Nigeria?
Yeah, Millicent, I agree with you. There's a need for us to really look at a sustainable strategy that can actually put an end to all this indefinite strike, happening too often. One of the first things I would like to talk about is to look at why are those promises in first place were given to these resident doctors. The federal government should also take that as a responsibility that for you to have come forward and say, okay, this is a promise you are making and you cannot fulfill. So it's a lot of issues that we need to really look at. And I think the fight, also the resident doctors, all other medical doctors, the medical team should work together. The fight should not be just a single person fight. They are asking for increase. I saw a notice of recent whereby other people are also agitating for to go for strike. I think there's a need to have a collective coming together to talk about what are the needs and what can they do to actually, address this? And looking inward, we need to also look at, as I earlier said, we need to look at how can we put an end to all this, resistant strike that's happened across the medical team, because this is actually grounding the system. But as I said, all the stakeholders need to come together in agreement, and we should also be looking at for a section of medical practices, we should be looking at bringing private people to also collaborate to strengthen this, because we cannot live the life of Nigeria in the hands of just one particular individual. But of course, the government needs to also keep to all the promises they make to resident doctors across the country. Thank you.
Paul, I wanted to quickly get your point of view, perhaps in about a minute, and this is your observation as to the pandemic report, and that is what is coming in from Nigeria as regards our daily numbers. We're opening up the sectors, the economy. Do you think that it is safe to do so?
Yeah, if I get your question correctly, opening of the economy, we cannot shut down the economy forever. As I earlier said, in part of my, coming forth to Channel TV, we need to open the economy. The school need to open, the airport need to open, everything need to, to start working. But of course, one of the major challenges that we usually have is the issue of, it's good to have a good system, putting a lot of protocols in places. But we need to really talking about the level of compliance in terms of, people coming to actually comply with what the government is about to do in terms of opening the economy. And for the school that the PDF has actually talked about, which is also very good for school to open, but we need to also try to discover that, to ensure that there is a system in place to check, and also to do a spot check on activity of some of the school, both the private and public, to see that there's a high level of compliance. So I don't know if, Millicent, I get your question
Yes,
correctly?
yes, and right on time as well. We'd like to thank you so much, Dr. Abiodun Paul, public health expert. Thank you for joining us on the program.
Thank you, Millicent, for having me. Thank you.
A member of the Adamawa State COVID-19 Committee and the chairman of the Christian Association of Nigeria, Adamawa State Chapter, Bishop Dami Mamza, has been certified free of COVID-19 after testing negative to the virus. The clergy made this known during a media briefing in Yola, the state capital. He used the occasion to urge Nigerians to take the necessary precautionary measures, especially by complying with the COVID-19 protocols, insisting that the virus is not a death sentence, but that many have died due to fear and panic.
In the first place, I think Nigerians need to appreciate more and more the efforts of the health workers, those in the front line, those that go out to collect the samples, those that work in the lab in order to make sure that they do the test, and then the doctors and nurses and other workers that go to the treatment centers. They really need to be appreciated. And that's why I feel very sad, like I heard it over the news this morning, that from Monday, the medical doctors will be going on strike. It's very sad. This is not when such thing should happen. The government should please attend to the needs of the doctors immediately so that there should be no strike. We don't have to allow strike to begin and then before you begin to find solutions to problems. Because there is no strike that takes place in Nigeria that will not lose life. And the life of every person is very, very important. So I call on the government to please attend to the needs of the medical personnel so that there will be no strike in the coming week.
No one is touching anything and everyone is cleaning everything, despite initial reports warning people that the novel coronavirus can be transmitted from contaminated surfaces. The Centers for Disease Control and Prevention in the U.S. has told Americans in no uncertain terms that the virus is primarily transmitted person to person through breathing, speaking, shouting and singing. While it may be possible to catch COVID from a doorknob or a package, it says it's a long shot. Joining us from Abuja studios is Dr. Haneku Suji, PhD, medical microbiologist, Deputy Director, Medical Laboratory Services, University of Abuja Teaching Hospital, Gwagwalada. Thank you for joining us on the program.
Thank you, Millicent, for having me in the program.
All right, first, tell us, does disinfecting high-touch surfaces keep COVID-19 at bay, or does it just make us feel better or safer?
Yes, definitely disinfecting the surfaces will definitely kill the viruses. So I subscribe, particularly in health facilities and the other places that may be contaminated with the coronavirus, there is need for disinfection. Even recently in University of Abuja Teaching Hospital, the laboratory was decontaminated. When we observed that some of our staff have been infected, although they were all asymptomatic and they were back to work. So I subscribe to disinfection of surfaces to kill the viruses and to prevent infection.
What's your take on the surveillance of the virus in Nigeria?
The surveillance in Nigeria so far, the NCDC and the PTF, they have done marvelously well with the guidelines. But unfortunately, most people have not been complying. A lot need to be done for people to comply to the NCDC guideline. Even though some people do not believe that there is fake, that is a fake news. But one thing they should know that COVID-19 is real. So actually, the NCDC, the PTF have done marvelously well in curtailing the pandemic. If you see in Nigeria, we are trying to flatten the curve, and the good news is that the curve is coming down. And if we can put in more effort, I think very soon the pandemic will be a thing of the past in Nigeria.
Suji, finally, what do you think are the prospects of the Russia vaccine for COVID-19?
Yes. When I heard that there is a vaccine, it's a cheering news. In fact, everybody, particularly myself, I'm very glad to hear about the vaccine. But one thing should be done. There must be caution. We should not rush to administer the vaccine to Nigeria. There is need for us to evaluate that vaccine, testing for efficacy and for safety before it can be administered to Nigerians. And in addition, I feel there is need for the country to have a committee to look at it, look at the local content, the possibility for us to even come out with our own vaccine. But one thing is sure, that before that vaccine is given to our people, there is need for evaluation, testing for efficacy, and also for the safety.
We'd like to thank you, Dr. Haneku Suji, PhD, medical microbiologist, Deputy Director, Medical Laboratory Scientist, University of Abuja Teaching Hospital, Gwagwalada. Thank you for joining us on the program. Libya today reported more than 1,000 new coronavirus infections, the highest tally for a single day since the conflict-ravaged country announced its first cases late March. Now, of the 4,291 tests performed on Sunday, 1,080 were positive. This is according to the National Center for Disease Control. Now, the figure brings the total number of COVID-19 cases in the North African country to 18,834.
As the number of cases continue to grow in India, doctors say hospitals are struggling to cope with fatigue, exhaustion, and manpower after nearly 6 months of relentless case increases. The total number of infections in the country have now passed 4.2 million, overtaking Brazil as a country with the second highest number of coronavirus infections globally. However, the metro in the capital, Delhi, has reopened more than 5 months after it was shut down to prevent the spread of coronavirus. Masks, social distancing, and temperature checks are mandatory, according to new rules released. Over in the United States, the total number of COVID-19 cases surpassed 6.27 million on Sunday, according to the Center for System Science and Engineering at Johns Hopkins University. The national case count rose to 6.27 million, with the death toll in the country reaching 188,909 as of 11:28 p.m. on Sunday. Finally, China's National Biotech Group has found 2 more countries to run late-stage clinical tests of coronavirus vaccine candidates. Serbia will test 2 vaccines developed by CNBG's Wuhan and Beijing units, and Pakistan will test the Beijing's Unite candidate. CNBG says phase 3 trials are expected to involve 50,000 people in about 10 countries, including the UAE, Bahrain, Peru, and Argentina. Phase 3 trials usually require thousands of people to verify safety and effectiveness of vaccines.
You can find further updates on our website, channelstv.com. It has the latest updates on the pandemic. And that's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.